Lyme is one of the bacteria that comes from ticks. There's also Bartonella bacteria, Anaplasma, Ehrlichia. There are some viruses like Powassan encephalitis and some of those things. There's a red cell parasite called Babesia that's malaria-like that comes from ticks that people pick up. All of these bugs produce inflammatory chemicals called cytokines when they die. So if you kill a bug, it's going to spew out a bacteria or a parasite. It's going to spew out a bunch of inflammatory chemicals that make people sick. So symptoms are Lyme, and mold symptoms. So you can have a lot of joint and muscle pain, nerve pain, tingling, numbness, electric shock sensations. It can make people tired. It can cause brain fog because inflammation causes thinking process to become muddled. It can affect your hypothalamus, so then you start having hormone issues and weight gain, or more rarely, but it does happen, weight loss. Just general fatigue. GI stuff is really common with kids and adults, so food intolerance, pain and discomfort, gas, bloating that doesn't really have a cause. Nausea, some people actually have nausea with vomiting. Those are the big ones. Urinary frequency, I think, is one of them that people don't always relate to Lyme and mold because they think, well, I drink a lot of water, so of course I'm gonna urinate a lot. But it's actually one of the cardinal signs of environmental toxicity or Lyme infection because some of your hormones get suppressed from the inflammation, and then you can't hang on to free water through the kidney. It's something that happens within 24 hours of an exposure to water damage building if you've become sensitive to that. I had a patient today who said, well, I'm peeing all the time. She had to leave twice during our hour visit to go use the bathroom. And she's like, well, I'm just thirsty, so I'm drinking a lot. No, you should not have to urinate twice in an hour no matter how much you're drinking. So there are some, funny things like that. A symptom can be anything. It can be in any body system, which is why it's really important to test and know what you're dealing with because a lot of things look the same. Bartonella infection, which causes a lot of rage and violent behavior, can also be, a mold toxin situation. Testing is really important, and sometimes people have both. All those things are biotoxins, whether it's an infection or an environmental exposure. They're all kind of the same chemical at the micro level, and so we can treat them similarly. The only exception to that is, generally speaking, if somebody has an active infection, we do treat the infection first, and then we clean up the mess and we clean up what's broken.